Welcome to the Surrogacy Warrior podcast with your host, Kimberly Surratt. Join us as we dive deep into the heart of surrogacy, offering insights, sharing stories, and providing advice. Our mission is to illuminate every corner of surrogacy, from the emotional roller coasters and legal battles to the triumphant moments of birth and beyond. Surrogacy Warrior is more than just a podcast. It's a community for anyone touched by or interested in the transformative power of surrogacy. You can find this show on all the major platforms, including YouTube, LinkedIn, Facebook, Apple Podcasts, Spotify, and on our website, lawyersforfamilies.com. Now here's the host of Surrogacy Warrior, Kimberly Surratt.
All right, welcome everybody to Surrogacy Warrior, the podcast where we explore all of the great and amazing ways that we can create families beyond what the traditional is. And today we have two wonderful ladies with us. They are the founders of Childbirth Allies. We've got Jennifer Cataldo and Jaimee Peck. And I'll let you guys introduce yourself and tell everybody a little bit about each of yourselves personally. We're going to talk about Childbirth Allies a ton, so we'll give that its fair shake. But who wants to go first?
I'll go first. My name is Jen Cataldo. Hi, thanks for having us. We really appreciate it. I have been a nurse for about 15 years, and that whole time I've always worked with the women and children. I've always been in the perinatal space, so hospital nursing, labor and delivery, postpartum, newborn care. And I did bedside for many, many years, and then I eventually moved into some leadership roles on my unit. So I did some nursing management. I did some professional practice leader, which is basically like a clinical nurse specialist, where I made improvements on the unit, got the nurses towards best practices when it comes to labor and delivery. And then eventually Jaimee and I started our business, Childbirth Allies, which we'll talk more about. And I currently work at the bedside again in a per diem role. So I work a couple shifts here and there at the hospital doing labor and delivery and postpartum, as well as running our business.
Jaimee?
Yeah, I am Jaimee Peck, as you said. I echo what Jen said. We really appreciate you having us on your podcast, Kim. Thank you. So I grew up in California in the Central Valley, and then I've been in the Pacific Northwest in Washington State for just over 10 years now. And I have 3 kids of my own. I have a teenager, a 14-year-old, and a 10 and 11-year-old as well. And I met Jen working at the bedside at a local hospital here. We worked labor and delivery and postpartum and those areas together in our birth center. And then I actually transitioned into kind of a case management role. And that's actually really when I became passionate about being able to provide more resources for parents, but more specifically intended parents. I just saw huge gaps, at the bedside when you're working with patients. You're kind of focused on keeping everybody safe, and that's kind of your main focus, and getting through a shift and everybody is happy and well and safe. And then you go home and then you come back and do the same thing. But in case management, we really help people set people up for success before they leave the hospital setting, and just realized a lot of gaps that existed in the for parents after they leave the hospital. So many parents would leave and feel like, well, now I'm supposed to take care of this baby. Like, you guys aren't gonna come with us, and I'm on my own. Are you sure everything's gonna be okay? So yeah, that's when I got really passionate about starting this business, and here we are.
All right, so let's talk about Childbirth Allies. You created it. You specialize in supporting intended parents, surrogates, generally the family, and navigating the journey of surrogacy through education, right, birth planning, and advocacy. So I want to chime in, and I want to say what's hilarious about this in some ways is that every single parent feels that way when they leave the hospital. I didn't do surrogacy, and I just stood there going, "You're letting me leave with this baby. Oh my God." But the thing about surrogacy is we do find there are a lot more gaps. I find it all the time where there's a little bit of a disconnect because maybe they don't feel like they're in the same position as every parent, right?
Mm-hmm.
And so I love talking to you today because I love the fact that we're going to start talking about some more of these services, these ancillary services we can provide to our families so that they really do feel like it's like anybody else in the hospital having their baby, right? So what do you do with your families? How do you help them?
Yeah, well, we do, just like you said, we provide childbirth classes that are specifically made for intended parents, and all intended parents are attending, so they're in good company. And then we also assist with birth planning with the intended parents and the surrogate together. And we have some other courses as well that support the surrogates. But I want to go back and kind of explain how it all came to be, because as you know, Jaimee and I were working together in the hospital. My best friends, they were down in California. We were best friends from college, and they had been struggling for many, many years with infertility. So they were going on like 6 or 7 years of just loss after loss and unexplained infertility, and just a lot of grief. And they had really isolated themselves from other parents, from newborns, from, everything that was they had to do to kind of protect themselves as they were going through this really difficult time. And then eventually they decided to pursue surrogacy, and they ended up having a successful journey. But as they were kind of getting towards the end of that journey, they thought, oh, shoot, we don't know anything about newborns. We've never been in the labor and delivery setting. We have not talked to our friends about birth. We have not done research about it. We don't know anything. And so they started to panic a little, like, we need to actually prepare. And, they're the type of people who want to prepare. Surrogacy is such an intentional process, and they've really done their homework on every single step. And now they're approaching, the biggest part of it, which is, meeting their child. And they felt very lost. And so they had reached out to me and said, hey, Jen, we know you're a labor and delivery nurse and a postpartum nurse. And can you just help us, teach us everything we need to know so that we're ready? And I was so happy to do it. I came down they had a baby shower with their surrogate down in California. I flew down for that, and I had put a whole class together. And then the day after their shower, we spent the whole morning. I had brought a little baby doll, and I talked to them all about what to expect, like in the labor and delivery setting, everything that, happens there, because it's a very chaotic setting and it's very overwhelming when you're not sure what's going on, what's normal, what's not normal, when to really ask questions, when to advocate, when to step back, when to support, So we talked a lot about that setting. We talked about everything that would happen in the hospital, all the decisions they'd be faced with for their baby. And then we talked about newborn care. How do they take care of their baby once they come home? Because, that's not something that is intuitive, unfortunately, for most people. Just like you said, parents leave the hospital and they're like, oh my gosh, now they expect me to take care of this child. And I don't have any training or experience in that when I'm a first-time parent. So we went over feeding and diapering and swaddling and soothing and sleep and, the whole routine, just to get them the basics. And after I did that for them, they were so grateful, and they just kept telling me over and over, this was so helpful. This is something that is really needed for intended parents, because there's really nothing out there that exists for us. And they had looked all over the internet and tried to find a class that was really tailored to intended parents who are going through surrogacy, and they couldn't find anything. And so they just really encouraged me to do that. I mean, probably a year or two went by after this that Jaimee and I were working together, talking about it, strategizing, thinking about it, and finally decided, let's do this. We can do this. We have the expertise, we have the knowledge. We want to support these parents, and it's a really good group of parents. We've found it to be so rewarding working with intended parents, because just as I said, they are very intentional. They're very excited. They want this child. It's their child. They're so excited, but they don't really know where they fit in the labor room and what their role is, and how to prepare. And they don't really want to go to a childbirth class with a bunch of pregnant women, and, where they don't really feel like a lot of what they're learning pertains to them, and it's kind of awkward. So that's what Jaimee Jaimee and I did is we created a space that was just for them and teaching them the concepts that are really going to be most helpful for them before delivery day.
So, when I think back on my career and I think about times when parents have called me with struggles or problems with the hospital, it's often the hospital staff. And I don't, I'm thinking through, obviously people need that one-on-one with you guys to deal with how to deal with a newborn, all that type of stuff. But Jaimee, what kind of advice do you give people on dealing with the hospital itself? Because those are the phone calls I get, where they've had problems. Staff that didn't treat them right, didn't treat them like parents, treated them like they were adopting their child. They're not adopting their child, right? And I never quite know what to tell them or, what's the best way strategy wise with the hospital.
Yeah, that's something that we touch on quite a bit, not only in our class, but in our birth planning service too. First of all, I think even just having a heads up that is a very common thing, unfortunately, in hospitals. Being called the adoptive mom and then the surrogate is the birth mom, right? Like even just things like that can be very triggering, very alarming, but also it can kind of create a break in trust if you're like, you don't even know what to call me, you don't even know what my role is here, and you're caring for my baby, right? So we'd like to just tell people that is a very common thing because hospitals often aren't. I'm going to be completely honest. I don't think I've heard of one hospital that has done specific training on surrogacy for their medical team. Meaning nurses, doctors, secretary, registration staff, everyone's just kind of learning on the job as they come across surrogacy cases. And then you add the fact that many hospitals are overwhelmed. Do they actually have time to sit? Like even if the intended parents and the gestational carrier were to be like, let's talk about this. Like I can help explain this to you guys a little bit. Oftentimes there's not even that kind of time for them to sit and hear these things. So I think first of all, just having a heads up that is very common, that most medical staff and other staff at the hospital are just kind of trained on the job. Just kind of having that heads up can be helpful. But then we also in our classes, and especially in birth planning, when we're having those one-on-one conversations with people, we give them a lot of tips and tricks on, as things come up, how to still be an advocate for your family and for your baby, whether that's when your surrogate is still in labor or after your baby is born. There are still plenty of ways you can still advocate for yourself. We kind of walk them through the chain of command in the hospital. If your nurse is not listening to you, here's the next step. And if that person's not listening to you, here's where you can go next. So kind of giving them that chain of command to look for if things are going south pretty quick. Yeah. So does that answer your question? There's just so much more I can go to in depth on that, but.
Yeah, I mean, because I'm a huge advocate of clients going directly to you to learn about how to work with their infant, what to do when they get home, all of that. And I think just from this perspective of Surrogacy Warrior, which is about advocacy and advocating for yourself, I think, part of what I want to say to the world through this podcast is hospitals need to be hiring you two to go do training with them, right? It's not just the parents.
Absolutely. Yes. Yeah.
I mean, I've had one hospital in the state of Nevada did come to me and work on setting surrogacy specific policies within their hospital, which is a good start.
That's something. Yeah.
Yeah, it's something, but like you said, it's not that next step of staff getting trained versus just coming across it, reading the policy for the first time and then going, oh, okay, that's what I'm supposed to do. Right.
Exactly. And it can, these, I don't know, misinterpretations, sometimes even biases of surrogacy itself can cause, it can honestly be the make or break for intended parents in the hospital setting and even gestational carriers as well. And that could be as simple as like, them giving the gestational carrier the baby bands after the baby's born and banded, and the parents, they don't understand that the parents get the bands, or it could be the headache of not understanding whose insurance the baby is on, and the whole headache and roundabout of all of that. The list goes on and on there. But yeah, I completely agree. We talk about this all the time. We definitely wish there was more training. We wish the hospitals would invest in this. But for right now, our piece is we can educate parents and gestational carriers on what the typical hospital setting may look like, and ways that they can still advocate for themselves and be a mouthpiece for their baby and for their family.
Yeah, I think one of the things both of you, I mean, it's that pre-education, both of you can really hit on that about, well, if you know to expect it, right, it's easier to handle. And so until you talk to somebody like the two of you and know, got that moment of panic isn't quite as panicky, right? If you had some prior knowledge and experience, or at least communication with somebody about it.
That's the
Yeah.
hope,
And
right? Yeah.
yeah. The other piece of it that I just want to add to this conversation is that, there's so much variation hospital to hospital across the United States. Unfortunately, there's just no uniformity, and where you deliver actually impacts your outcomes the most out of any other risk factor, which is a crazy thing to think about. Even in the general population, I'm talking, like, depending on where you deliver and who's taking care of you and what that hospital does, that makes the biggest impact, which is really unfortunate that that's the way healthcare works in this country. And Jaimee and I, we do part of our birth planning service is to call the hospital at the end and make sure that they have everything that they need for that group and that they're ready to go, and we get all their questions answered, because a lot of times we want to ask the hospital specifically, how do they handle surrogacy? How do they handle the rooming situation? When do intended parents get their own room? If they get their own room, like what's the OR policy? What do they do for XYZ, right? So when we make those phone calls, we have found an incredible amount of variation in the responses. Unfortunately, we've had experiences where we've called hospitals and the charge nurse has told me that they don't understand what I'm talking about and they're using the wrong terminology, and I'm trying to educate that person on the phone, because it really upsets me that I'm like, you're in charge of the shift right now and you don't even understand surrogacy, and this is important, you need to understand this, and it's frustrating. And then we call other hospitals and they're just wonderful. They're just like, yes, we do surrogacy all the time, we love this, we are going to give the parents their own room right next to the surrogate's room in labor, and then we move them to postpartum and they're going to be in rooms nearby over there, and we've got a whole process for this, and they seem super knowledgeable and informed. So there's such a variation, and then we will kind of follow up with the parents and the surrogate and kind of let them know, hey, this hospital is wonderful, or hey, this hospital, it's going to be a little bit of a struggle. I just want to warn you that you may be called the wrong thing. I'm so sorry if that happens. Feel free to educate them if you want to or not. That's up to you. But I want you to focus on having a good experience and getting what you need. And we'll talk about how to advocate, how to escalate if needed, all of those things. So so getting in contact with the hospital can really be illuminating in what their stance is on it.
Well, and for the intended parents that are listening, because we have a wide variety, obviously, of people that listen to the podcast, but it's not as simple as dictate during the contract what hospital. There's a lot of other factors. So don't just come to me and say, I'm only going to allow a surrogacy-friendly hospital, because there's other factors. Insurance, obviously, being one of the most major elements. When only one hospital's covered, you're going to the one that the insurance covers. That's about all. And unfortunately, that narrow margin on insurance, it's growing. It's getting worse and worse what the provider lists are.
Yeah.
And then two, know that no, we don't just force surrogates to do what you want. Intended parents, they have a say, and you're not going to make them drive 100 miles just to go to a specific hospital that you want. It's not that simple when you're pregnant and at the end of your term, right, ladies?
Nope.
My intended parents always think, well, she can just get to this hospital. Well, we don't always get where we want to get to when we're in labor.
Nope.
Yeah.
Yep. Sometimes you don't have a choice. Your baby is their baby is making that decision for their surrogate. Yeah.
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 Yeah. Or ambulances choose for you, depending on what the
Yeah.
circumstances are, right?
Yeah.
But is there, at what point in the journey do you recommend that intended parents hire you or come to you for that information? I mean, this has kind of enlightening because I'm thinking through the contract phase of it, but that's a little early probably to be engaging your services.
I think a lot of the conversations that we have with intended parents and their gestational carriers are also important conversations to have at the beginning of the journey. But something that Jen and I have found is for a lot of people, especially the parents that have been through years and years of infertility, there's just like Jen's friends, it really doesn't hit them that they're actually having a baby typically until about viability age. So around when their baby's around 24 weeks old, or sorry, 24 weeks gestation. So we typically, and then at that point, it's like, oh my gosh, we're going to have a baby, just like Jen's friends, right? And then it's kind of feels like a scramble to get everything ready and all the preparation. So we typically, I mean, we work with people as early as 12, when their baby's about 12 weeks gestation. But typically we start working with people around like the 24 to 28 week mark. And that's when we do a lot of the education piece. And then from there, we do birth planning. And we typically like to have that birth planning piece done before like the 35 week mark. So between 24 and 35 weeks is a good prep time. Still lots of time to prepare and have good conversations and make decisions and things. But all the stuff, all the education is still fresh in their mind when their baby arrives.
Yeah, and sometimes there's decisions that were made in the contract phase that come into play with us, and we're like, oh,
yeah,
like you already made an agreement about pumping colostrum and breast milk, and and now you're saying you don't really want to do it, or like sometimes we have to navigate some of those things, and it's hard because from our standpoint, when we're making a birth plan, this is a very flexible plan, and we're always explaining like this is not a legal document. These are everybody's preferences, wishes, boundaries. We're kind of creating a plan best we can, knowing that anything on this can change in the moment. People can change their minds in the moment. If you plan to cut the cord and then you're like, I feel lightheaded, like you're not going to cut the cord, right? So there's nothing binding in what we're doing, and yet we're sometimes working with a contract, things coming up from a contract that were decided before anybody was really wrapping their head around actual delivery day. They were just kind of talking in the beginning, and so sometimes we don't really know, like, well, we know we have to like abide by those things, but we're kind of, that's not really our our space, and so we just try to kind of talk things out with everybody and make sure everybody is in agreement about the general plan for delivery day. So
I think it's probably one of the best things we've said today, just because for lawyers that are listening, it's a fine line. I mean, most of us should be drafting our contracts, at least on pumping of breast milk. For those listening who are inexperienced in surrogacy, know that we never have her breastfeed. We don't want that attachment. We don't want that psychological problem there. But for pumping, the contract should be drafted to just say if she is willing, if she is able at that time, then at least set the boundaries on what reimbursement of costs are going to be, because we need to deal with at least the financial end of it, but not the mandate of it. My favorite terms, my clients always laugh at me, but I always tell them, look, boobs are not faucets. They don't just turn on and off.
Darn it.
They're not that easy. They don't work that well. If they did, it'd be a whole different scenario, but they don't. And so we can't dictate to that level. We shouldn't be. So if contracts are looking like that, rethink your contracts for those of you that are listening. They don't need to be drafted that way. They shouldn't be drafted that way. All right. So when we talk about birth plan, I think we keep using the term birth plan, and you've mentioned a few of the items that go into birth plans, but I don't know if generally people know exactly what a birth plan is, or what that means exactly.
Yeah.
Do you want to get that one, Jen?
Sure. I'll cover some of the elements. But yeah, they can all look a little bit different. Sometimes surrogacy agencies have their own template, and we'll go off of that, or Jaimee and I have our own template, and you can actually just go on our website and grab those, download them for free if you want to take a look at them. But generally, there are decisions in the beginning that have to do with labor, which are all the surrogates' decisions. So, generally things like, does she want, what kind of pain control does she want? Does she want to go unmedicated, or does she want to use an epidural? Does she want to remain pretty mobile? Does she have any specific preferences as far as labor? Who does she want in the room with her during that phase? Who does she not want in the room? What are her privacy concerns? Like, if she's pushing, does she want people to stand by her head? Is she fine with anyone seeing anything? Does she want them behind a curtain? So privacy concerns, what she's envisioning for labor, pushing phase, what that looks like. And then there's kind of as soon as a baby's born, that's kind of when, the parents become the decision makers for their child. So then all the decisions become the intended parents. So who's going to cut the cord? What happens if they want anything with the cord blood or cord tissue, if they're going to do any banking with that, if they want delayed cord clamping and how long, if they want to do skin to skin, if they want their baby swaddled, if they want to move to their own space right away, or they want to all stay together as a group and kind of recover together for an hour or two and then move. So what happens, if the intended parents are not there at the birth, what they would like with their newborn, who is going to care for their newborn versus the surrogate or the nursing staff. We talk about travel plans, and kind of a big part of what we talk about is also after birth. So everything that they want with their newborn as far as medications, assessments, things like that. And then visitation. So what does the relationship look like after delivery? Do they want to have a visit in the hospital altogether? Does the surrogate want their children to meet the baby to have that closure? Would they like that to happen in the hospital? Would they like that to happen outside the hospital once everybody's kind of in their Airbnb, or, whatever the situation is if they're not local? So we kind of talk about all of that. And I think it's really important to talk about it all the way until, let's talk about the relationship after and kind of what that looks like and the communication that everybody wants, because from what we've heard, that can be a big source of dissatisfaction if people feel like they were sort of ghosted after delivery, or they feel, and sometimes it's just misunderstanding, is from what we've experienced, is that the parents will say, well, I just don't want to bother her. I know she's probably resting and recovering, and we really want to respect that space. But then the surrogate may feel like, oh, they haven't even checked on me. Do they even care about me? So there can be a lot of misunderstandings if these things aren't discussed ahead of time. So that's part of the birth planning that we do as well.
So our
Jaimee, you want to add?
Yeah. So our class is really to give information, right? It's really to start getting their wheels turning about conversations they should have with their partners, with their support people, what decisions they should make for their baby. So it gives them a lot of great information to start with. And then our birth planning piece is just a really individualized service where we're walking them through and doing a lot of education to be able to paint a realistic picture of how things go. And then if things change and they don't go that way, what it could look like next. So it's really just kind of working through, like Jen said, everybody's preferences, boundaries, desires, making sure everybody's on the same page as much as possible going into delivery day. But there is a lot of education in that birth planning piece as well to help people really understand the decisions or preferences that they think they may want, so that they can have a very realistic idea of what kinds of things to expect.
Okay, so I want to touch on where lawyers in it here again, which is who's present in the labor and delivery room. And because it's an ongoing debate, controversy, it becomes an issue in a lot of contracts between intended parents and the surrogate. And, I'm of the firm belief that the contract should be drafted in a way to just say, if the relationship is still doing well, and the surrogate is still willing, that she will consider having the intended parents in the labor and delivery room. And I know there's a lot of intended parents that want to just hit the ground and scream and cry over that and be extremely upset about that, because they want to be present. And I get wanting
It's
to be present.
understandable.
Yeah, it's understandable. But what lawyers need to contemplate more often, instead of mandating that they have a right to be in the room, which no hospital is ever going to comply with that contract. They're going to listen to the
Correct.
patient, right?
Correct.
Okay. Is that, things change. And I tell intended parents, look, if the husband starts creeping out the surrogate, she's not going to want him in the room. Maybe she'll want you, intended mother, but maybe not the intended father. If you are not getting along at all, like, do you really want her in additional stress during the labor? If the intended parents are just being aggressive. I mean, a lot of this relies on the intended parents, but also the surrogate having some acknowledgement that this is a moment they won't get back if they're not present. And so I think the point of my conversation is, I think you two are far more critical in this conversation than most lawyers know, or is that they don't know about your services. It's extremely important, because if you can protect her privacy, they're in the room, but they're not really watching everything, right? Or interacting
It's
with her.
absolutely doable.
Yeah,
Yeah.
the relationship's not going well. And I assume that with some of your clients, that relationship has deteriorated with the surrogate. And gosh, I want you dealing with this, not me. I'll be really honest.
Yeah. I mean, we have had some really strained relationships that we have been working with those groups, and to the point where I'm like shocked that, because it is ultimately the surrogate's decision. It's her body, it's her bodily autonomy. She is that patient in the hospital, and so, like you said, the hospital staff is going to defer to her while she's in labor as the decision maker for herself, her body, and that fetus at the time, right? Because until the point of birth, the parents don't have decision-making power. And so it is her decision. But I will say that even in the most strained relationships that we've worked with, I'm always shocked at how much the surrogate still wants the parents to have that moment and still respects that and understands that. I mean, every surrogate we've worked with has children of their own. They really understand how special that moment is, and they still want to respect that even when the relationship is strained, and we find ways that feel okay on both sides. And it is just sometimes talking about, okay, how can we make this feel okay for you, and also give you permission to change your mind in the moment. And I think a lot of times in the moment, surrogates do invite the parents in even when the relationship is strained, but it is ultimately their choice, and we really do need to respect that. And if the parents need to be just outside a curtain, or sometimes they end up in the operating room unplanned, and the parents can't be back there, and it's just the hospital policy they have to abide by. So if that's the case, then if their baby's doing well, then about 5 minutes later their baby can be brought to them. And so that's not ideal, but it's still going to be a beautiful experience when they meet their baby and their baby's just been born, and they're going to have that. So but Jaimee, I know you've worked with some of those difficult ones recently. Do you want to add anything onto that?
Well, I just want to say that from a medical perspective, I really appreciate your the way that it sounds like you draft contracts, Kim. I am going to be completely honest. I don't read contracts. That's not something that I am trained to do, but in working with clients where relationships have deteriorated, oftentimes, it'll be the gestational carrier. They'll kind of waffle with like, well, I would really, like Jen was saying, I still really want these parents to have that experience of watching their baby be born. But I also know the stress, just them being in the same room as me, causes me, and I want to be okay, and I want their baby to be okay. So they kind of waffle with that for a little bit. And then if they ultimately have decided that they don't want one or both intended parents in the room or operating room during birth, Obviously, like you said, that upsets intended parents often, but I've seen multiple times where it has to go back to legal because the intended parents do kind of kick and scream, and our contract says, and they interpret it one way, but the gestational carrier has interpreted it another way. And so I think just leaving that language much more open in the contract phase is probably very helpful, because there's so much that happens between contract and birth, and there's so much time that passes. They all go through so much together. You have no idea how that relationship is going to end. So it's the difficult cases where the contracts clearly leave more. I guess I don't really know what it would be what it would be called, but just more open language. And not hard, fast. The intended parents will absolutely be in the room. They will be here for birth. I think that's been very helpful in those cases that I've worked with that have deteriorated. The relationships have deteriorated.
Well, language like that doesn't contemplate all the numerous facts and circumstances that can happen, right? It doesn't, I mean, if surrogate's in a major medical crisis, why, of course her spouse is going to be there. Of course she's going to want her support person, and she's scared, and she's in, her life's at risk at the moment. And
Right.
in what world, does a hard, fast contract language that says the intended parents have to be there and no one else make any sense? It doesn't. It's inhumane. And so, it doesn't
Completely agree.
contemplate what's, all the possibilities of what can happen. I mean, we've had plenty of circumstances with surrogates that are just doing it just because they're just not getting along with their intended parents. And they're doing it because they just want to be ornery and cause problems, right? But then again, it's still her body. She's still in labor. I tell people, unfortunately, our intended parents, you don't know what that physical effort is, and it's a lot. And so you want your person that you want to, just like in the movies, scream and cuss at and tell them while you're pushing, but it's true. It's a reality. It's a real thing. But
I will say too that I think I've seen more disconnect on what the labor room or the operating room or wherever the birth room is may look like when a gestational carrier, it's their first time being a gestational carrier. So when they're signing up for it, maybe they don't quite think about or understand what those different dynamics will be versus when they had their own baby and what that birth room looked like. So those are the cases that Jen and I spend extra time with too, is when a gestational carrier hasn't been a gestational carrier before. This is the first birth that she's going to have as a gestational carrier. And we talk through a lot of what the differences are versus when she had her own children. But we also try to include their support person, because oftentimes they don't understand what their partner has signed up for either. I came across a case recently where a father he didn't, there was no conversations ahead of time, and he was very, very uncomfortable with the gay dad's bead in the room for birth. But that was something that was never talked about. And he became very combative to the point where security almost had to escort him out of the hospital. But these are such important things to talk about ahead of time, not only with the intended parents and the gestational carrier, but also with the GC support person. That was a little bit of a tangent, but I do think it's an important piece in all of this.
no, it is, because it's a reminder that there's a lot of people and parties involved in this process, right? It's not as simple as just a woman giving birth, whoever her partner is or isn't. And
Yeah.
I think that was a very critical part of it to talk about, because you're not, the modesty is not a thing in a labor and delivery room.
Nope.
And when you're technical strangers in the room with you, it's hard enough to have medical staff strangers, right? It's a whole nother thing, to have a whole nother set of people just there for the sole purpose of watching. I can't imagine, when I gave birth to my son, that would just be bizarre to me. I didn't even want my mother there. She
Right.
wanted, I refused. And that's where I love advocates in hospitals, because the nurse was the best person in the world to me, because she said to me, you told me at the beginning you didn't want your mom in here. Is it still true? And I said, yes. And she said, I got it. I'm taken
Yeah.
care of.
She's like, you won't see her. That's awesome.
Yeah, and that's part of our role as the labor nurse is to like manage that room and make sure that the dynamics are working for the person in labor, because if you're not feeling relaxed, I mean, you're not relaxed is the wrong word, but you know what I mean? If somebody's throwing off your vibe, that's going to affect your labor progress too. Like you need to be in the zone. You need to be focused on what you need to be focused on. And so a lot of times, the conversations we're having during birth planning are we need to all give each other permission to say, I need a break. I need to, I need to take a nap. I need to just be alone for a little bit. Or, as the parents, I need to go eat. I need to go step out and rest. I need, because they got to save their energy for when their baby comes. And so on both sides, it needs to be okay to have that space. But yeah, I think that the GC support person is this whole other dynamic that often gets forgotten about, as Jaimee said. And we always invite them to come to birth planning, but a lot of times they don't. So I like to ask the intended parents kind of what their relationship is like with the GC's main support person, who's also going to be in the room, because, I just want to make sure that do they have any relationship, or have they just been kind of an absent party, and just kind of making sure that there's a little bit of communication ahead of time with that person too, so that everybody feels respected, because not only now are you watching your love, maybe your wife or whoever that person is, go through labor, but you're also having these other people in the room, as you said, like kind of like spectators to it. And so that protective mechanism can come into play. So we just have to be okay with saying we need a little bit of alone time, or we need some time to regroup. Like we'll have the nurse call you at the next check, or at the next, whatever the next time that you all decide. So that's totally okay to take breaks, even if you're allowed in the labor room. Doesn't mean you have to be there constantly.
Yeah, I can imagine. There's a lot more to this than I think, obviously people just don't realize, and as intended parents always say to me, well, I just don't know. And it's like, well, you're not supposed to know. It's different. It's not the everyday average thing. So it takes professionals who are used to it, who do it all the time and work with people all the time. All right, my friends. Well, I appreciate you so much. Can you please tell everybody, you've got your website on here, but go ahead and say it because we're also, it's audio, and tell everybody how to get a hold of you and how to utilize your services.
Yeah, absolutely. So childbirthallies.com. You can find all our services there. We also have Instagram at @childbirthallies, all one word. So please come and follow us there for some fun tips and keep in touch with us. You can email us, connect@childbirthallies.com. We love to stay in contact with everybody that we work with. So if you come to one of our classes, we always love to stay connected. You can continue to ask us questions via email after we work with you. So sometimes people reach out even after their baby's here and they need a resource or get pointed in the right direction. So we're here to support in as much of an ongoing way as possible. Jaimee, you want to add anything?
Nope, nothing to add there. But thank you so much for having us, Kim. We really appreciate, again, you having us on. And we love what this podcast is about. Jen and I are all about advocacy and helping people know how to speak up for themselves, especially in the hospital setting and leading up to birth. So we really appreciate you having us on. Thank you.
Oh, absolutely. My pleasure. All right, everyone. Thank you for joining Surrogacy Warrior podcast. You can find us on all the major channels. Make sure you like and follow us and let us know if you have any additional programming ideas that you would like to hear from us. But in the meantime, remember that you are not alone in this journey. You've got people like Childbirth Allies by your side, and together we are all warriors, and we will get you there to the front finish line. All right. Thank you, everyone.
You've been tuning into the Surrogacy Warrior podcast with your host, Kimberly Surratt. You can find this show on all the major platforms, including YouTube, LinkedIn, Facebook, Apple Podcasts, Spotify, and on our website, lawyersforfamilies.com. Thank you for your positive reviews, comments, questions, and for sharing this show with others.